Dr. Nacho. I'm here with Daphne, and one of the things I thought about today before we get started with our coronavirus update is that we're never going to get this chance again. And what does that mean? We're never going to get this chance to get, we're dentists. It's not easy to be dentist. Daphne made me a heart sticker today, so we're never going to get this chance to have this downtime again. It's over there. So I asked Daphne before, let's bring her closer to the screen. Right here, you get up on your knees so people can see you. I asked Daphne, we did a video, I asked Daphne, how come we're inside so much now?
Because the virus.
Because of the virus, but being inside could be cool. Like, what are some things that's fun about being inside?
You get to play and have no school.
You get to play and have no school. That's nice. We get to play and have no work. I've been eating a lot of Cheetos, eating like I'm in college without the metabolism. And then you did your own hair today. Could you tell them why your hair looks like this?
It's not a hair clip. It's a tassel for a scooter, but I just put it in because I wanted to.
But that's cool. So that's CPS, creative problem solving. So Daphne wanted a new hairstyle. She used a tassel from her scooter because you wanted to think everybody did what?
I wanted to think everybody had
They thought that you did what to your hair?
Dyed it.
That you dyed it.
And they dyed pieces of hair, and then it turned out just these were pieces of hair, but they colored it like.
That's so awesome. And you wanted everybody in your life to hear it, to see that. And right now there's only 4 people. Your mom, Mrs. Nacho, your uncle, Jeff Nacho, Drew, and me. So 100% of the people saw your dyed hair. So I'm enjoying spending time with you. So remember, we never get this chance again. I know it's tough. Whether you're home all alone, you could read books and do whatever you want. Whether you're with the moderators trying to get them to act okay on Nacho Zoom TV, we're not going to get this chance again to get this timeout. So this forced timeout here, try to find some of the goodness. It's our weekend coronavirus update. While it's still so serious and such a big thing in our lives that we have to pay a lot of attention to, we also should remember about fun. Okay, Daphne, moderator, I'll let you go and we'll do this. Go up to Uncle Jeff's. Okay, so I am back here. I have some notes here. This is for you guys to ask. Beautiful unicorn. Thanks, Aggie. And let's see. Carlos, can you hear me okay? Cool. Okay, cool. So this is one of my favorite books, The Checklist Manifesto. And I know that there is one question on everyone's mind. I have some notes over here for my checklist. I have my checklist here. So I know there's one question on all of your minds and all you were thinking. How many Nacho t-shirts do I own? And the answer is a lot of Nacho t-shirts. So if this goes on, I'm going to go through my entire supply. I got green ones, I got red ones, I got orange ones. So you can look forward to that. But the one question, so we talked about Daphne with her hair, creative problem solving. What kind of creative problem solving can we do as a dentist and community, in our families, in our practices? I think some of the themes should be to protect our practices and prepare for what's next. Protect our practices, prepare for what's next. There's a lot of tough decisions coming down that we have to make as business owners and leaders. Is our team going to go into unemployment right away so they can be paid by the government? Is that what unemployment is for? So that we can maintain being able to pay some of our other vendors out there. It's a tough decision. I'd say get a list of all the things you pay, go through it. But like we talked about yesterday, everybody is connected to this. We are all one. We're all in this together. Don't just cut off a $49 service, technology service, because you say, oh, I can't pay that this month, because those people have companies that pay people. So they're tough decisions that you should make with the help of your advisors, talking them out. If you want to ask questions here, feel free. So I got my my COVID update checklist here. So let's talk about this one question. And what is the real one question? Not how many Nacho t-shirts do I own? And the one question that all of us should be focused on right now is, how can we open up our offices and get back to work safely for these 4 groups of people? How can we open up our offices and get back to work safely for these 4 groups of people? So in my email today, Angel is putting into the Zoom chat and the Facebook chat, every day we're looking to broadcast a complimentary CE on TV show. Today we did the amazing Dr. Mark Costas, tag him if you can. His System for Success that we broadcast was awesome. You're going to get back to dentistry someday. Learn some stuff with your downtime. Yes, eat Cheetos, watch TV. I'm doing a lot of that. One of the reasons I'm okay not going out to dinner tonight, I don't want to put too much pressure on the server, because I'd be like, what wine pairs well with the end of earth? That's my joke for the day. What wine pairs well with the end of earth? My teammate, Amanda, texted me that she's drinking up all her expensive wine because she's running out of the cheap wine. And I think that's a great idea. Drink your expensive wine now. I also saw in our fridge that Mrs. Nacho bought some Elio's pizza. So I was brought back to my chubbier days of the 1980s, now in my chubby days of the 2020s. But what is this one question for us to talk about? And this is for us to connect. This is not to be formal. How are we going to open up our offices safely? How are we going to be allowed to go back to work safely? And here's what we're up against. And here's why we need to be loud and annoying, kindly annoying to the CDC and OSHA. Maybe we should start writing emails now. Because here's the issue. We have the COVID-19 virus. It's not transmitted through blood. It can be transmitted through the air, through touching with washing your hands, but through the air. So if you are using a Cavitron in your office or drilling on a tooth, and you create this aerosol on a 30-year-old who may not know they're infected with COVID-19, and then a 70-year-old walks in next, how can we protect that 70-year-old? Furthermore, how can we protect our employees? I just used an example on Nacho's. It seems like the Canadian dentists, they have it together. They're all shutting down. They're in unison. They said there's like 1% of dentists that are not. It's a little bit different here in the US. We have all different types of fragmentation. I think that's a problem for us at this time. Shutting down, social distancing, even the most strict, I don't want to say, even the people who feel this is not a big deal are into social distancing. And I want to share with you, how can you social distance in a dental office? It's impossible. We're all less than 6 feet away. So we have to go through this social distancing period. But how are we going to keep our offices safe for our patients, our teams, our dentists, and the families of dentists? So I'd like you guys to hear, does anyone have any suggestions? Canadians always have it together. I'll look at the Facebook Live chat too. Anybody want to share with me? Angel, tag me in that Facebook Live chat so I can see it. How are we going to keep our team safe? So right now, the CDC and OSHA need to be working on this. And I believe we should be emailing them and saying, hey, what are you going to do to get dental offices open again? We're a big part of the economy. We're also a big part of helping people. People are going to have issues. And I have an awesome resident from back in the Einstein days, and we're going to talk about that next. So one of the things we should be focusing on, how do we get our offices open up safely? Right now, the masks that we have do not prevent the transmission of COVID-19. I know people are saying it also doesn't prevent the transmission of the flu, but the flu is different. We have vaccines for the flu. It's been around for a long time. Don't think of, if you want to open up here, this is some reality. We talked yesterday, I don't know if you saw it, Maggie, about this. JBN is what I say when we're arguing over fee for service or PPO. JBN is what I say when we're arguing about implants or root canal, because they're both can be good. JBN is for us to be kind on our normal daily dentisting life. This is not our normal daily dentisting life, and it is now JBR by Paola. Just be real. Just be real is for a crisis. Just be real is for when we're facing something we've never faced before. So with this JBR, don't worry so much about opening up your dental office again. Worry about, will the patients feel confident to come to your dental office? That's a real concern we need to solve, whether it's through air filtration. So the CDC and OSHA, I encourage you, write them an email and say, what are you doing about dentists? The ADA, I was on with them on Monday. They're lobbying for us. That organization is doing what it can. I don't know all the things they're doing. There's other group leaders here on Facebook doing interviews with the president of the ADA and other people, but it's also up to us to advocate for ourselves, to make the CDC and OSHA aware, because from yesterday, it says they have 30 days to figure this out. And the CDC, guys, is what protects people. OSHA's what protects employees. So we need both of those groups to be safe when we go back to work. So let me go on my checklist here. Okay, perfect. So I'm so glad I have one of my past residents, super nice New York City dentist. I hope he's having a mojito with your COVID crisis 19 update. Here, before I get to my next thing, I told you the Dr. Nacho drink of the day. So you should only have one drink during this crisis a day, but no one tells you how big the drink should be. So today's drink is a project I've been working on for a while, and you may as well finish it during the coronavirus crisis. It is this. My awesome associate gave us this a while ago, and we're just going to work through it because the wine stores here are closed in Philly. So we're going to work through alcohol till we get to the alcohol we would have drank when we were in college. So back to what constitutes a dental emergency. What constitutes a dental emergency? So I I'm a medium-aged dentist. I've been a dentist for 17 years, going on 18 years. Medium-aged dentist. I was the chief resident and hospital fellow at Albert Einstein, and I had to train residents after me. And we would sometimes open up in the morning and have 30 patients coming in with emergencies. How could we determine which patients were emergencies and which were not emergencies? How could we categorize them like bad, mad, sad, to acute emergency, urgent emergency, no big deal, take care of it later, you're just complaining? We need these categories. So what are some ways that you categorize if something's an acute emergency or urgent? And we talked about with this on the ADA, and their definition is narrow and strict. It is about life-threatening emergencies. So I will share with you what I did at Einstein to create a system. Everything that matters needs a system, and everything matters. One of my sayings back here from the boards I make: everything that matters needs a system, everything matters. So how can you classify emergencies? Here's what we did at Einstein. No, not related to the COVID-19 crisis. Hi, Mrs. Smith, your tooth hurts, blah, blah, blah. We had this little room. We had to triage people. This is how I started. Okay, tell me what's going on. Let me just ask you a question. Do you have a problem breathing? Do you have a problem breathing? No, I don't have a problem breathing, okay? Do you have a problem swallowing? No. Let me see your face. Is anything like out of line? Is it swollen at all? No, 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 no. This is not a true emergency in this moment. It's not life-threatening. Now, we might take a quick look around and we might see an intraoral swelling. That could be urgent. They may have a 9 out of 10 pain. That could be urgent, moving towards emergent. We don't want to do anything to jeopardize true emergencies, because we had a podcast with Rob Montgomery, Linda Harvey, and Anna Slinsky. And here, watch this. I'm going to ask you guys, we're here together talking on Facebook Live and on Zoom. So you guys are dentists. I'm talking to dentist. And Angel, just tag me into Facebook Live one more time. Somehow I can't see my own Facebook Live. It's a trick within a trick. So I have my people out there. This is you. What would you do? You're sitting at home right now. You have 5 out of 10 pain. You have 5 out of 10 pain. Your tooth is broken. The only place you could go is to emergency room. Are you going to wait at home, or are you going to go to the emergency room? Who's going to go to the emergency room today for that type of pain? Anyone out there? Yes, no, you want to vote? Raise your hand. Okay, now I have another one. You notice a swelling, your face is getting swollen down here, and you're having a problem swallowing. Let's take a look at that scenario. An urgent one moving to emergent. We're all general dentists, most of on here. Maybe there's an oral surgeon. Is anyone have anything in their general dental office that can fix a swelling out of the side of your face moving towards a Ludwig's angina? Hey, look at that. I'm bringing it right back like Krebs cycle. Ludwig's angina. Who is Ludwig? How do you get named after that? Anyway, can we fix that? Can you fix that on the Facebook Live? Let me know. Let me know on the Facebook Live or on the Zoom chat. Do you feel comfortable trying to fix an extraoral swelling with a person starting to having swallowing problems? Anybody feel comfortable with that? Because I don't feel comfortable with that in my general dental office. Because what do we need? What do we need to try to fix that? We need IV antibiotics, maybe an IND and IV antibiotics. We've done a lot of INDs. I've done a lot of INDs in my day. Sometimes they work and you get all this purulence coming out. Other times you get nothing. It's not coming out, and that's not enough. So one of the things that I have a suggestion is we need to get our oral surgeons and endodontists in communities talking, getting them the best PPE so we can create rotating centers of where to send people, because everybody coming from their couch trying to solve these emergency problems is going to be chaos over the next few weeks. So this is something we need more information on. This is something that we need people advocating for us on. So that is on my checklist here. Okay. Danielle and Austin Davis, they're also on our list. They are going to drop into the Facebook Live. They have an awesome offer for a startup practice. Dr. Danielle Davis came to our new dentist boost camp. She was amazing. She talked about how she started her practice, and they have put together an inspiring course that they're giving people access to for 7 days. So even if you have a practice, you could learn something from that. Apparently, they're out right now shopping for food before things get shut down. So they are going to drop that into the comments later. Tomorrow at 1 p.m., we have Dr. Desiree Yazdan. We're broadcasting her CE on TV about social media. Here's a good tip. One of my friends is on here, wrote a great article. Please put that in the Facebook Live and on the chat. And we have a lot of downtime, so let's use it productively. This could be a great time to enhance or start your social media accounts for your offices. Starting next week, I'm going to look to connect with patients through social media, whether it's making videos, maybe it's a video of trying to get the moderator to brush their teeth. I put that on my Facebook page. I put that on my Instagram story. I send out an email and I give people a chance to laugh and just say, hey, everybody, we're thinking about you too. This is about the 2 hows. What are the 2 hows to get through this? Ask other people, how are you doing and how can I help? Ask other people, how are you doing and how can I help? Makes them feel heard. There's a lot of great content on the Dental Nachos Facebook group about how we have to protect our mental health. Just ask people, how are you doing and how can I help? Maybe you can recommend, like I've talked about, a Netflix show, a good book, a workout program. That maybe you can text me, stop eating Cheetos and go work out, because that seems to be what I'm doing with my downtime a lot. So if anyone has any suggestions on how you can help virtually, that's a great thing to do at this time. On my list here, text GUAC, G-U-A-C, to 33777, 33777. Text GUAC, G-U-A-C, to 33777, and you'll get an awesome course from Lisa Mergens for free on leadership. So I'll be happy to take a few questions. I'm also going to go over a few questions that we had asked, people had sent in via email over the past few days. Any questions from anyone here? Let me just check here in the Q&A. Feel free to write any questions in here as well. So we'll go off of our paper. Okay, guys. I want to check our Facebook Live. Usually Angel's doing awesome helping me here today. I just want to check in here on the comments. Sorry, you guys have to see my face up so close. Someone says they have a cell phone for an oral surgeon. That's good. Connect with your specialist out there. Right, ask how they're doing is important. Okay, great. So let's go over a couple questions here. Then we'll jump off, and everything in the Zoom chat and the Facebook Live chat is stuff that you guys can utilize, Nacho resources. Also, I'll talk about our 14-day CE challenge at the end. What is the ADA advising on aerosol-producing procedures that are emergent, like i.e. doing a pulpotomy on a tooth that is savable or maintainable? The answer is, I don't know. I interviewed Linda Harvey, OSHA expert, and she said, we're not sure if the current PPE we have is going to prevent transmission of this. One of the challenges is people who may be infected before they show symptoms. This is where you want to keep your attention on this each day. And if there's something that, if people say, what can I do to help? Here's what I think you can do to help. Email the CDC and OSHA. Try to be an advocate for dentists to say, what are you going to do to help dentists get back to their offices safely for their patients, for their employees, for the dentist, and for the families of dentists. My office is working 100% full go. If I say no due to lack of proper PPE, can I be fired? This is a super tough one. Hopefully, as mandates come out, that offices are shutting down to everything that's elective and really only honing in on these true emergencies and identifying emergent, urgent, medium deal, no big deal. A sensitive tooth. Someone online last night said, what if your daughter broke her tooth in the back and it was sensitive? I'd say we're going to stick it out for a few days. I think everything that we do, we'll stick it out for a week. Everything we're doing today, stay home, stay safe, stop the spread. Everything we're doing today is helping our healthcare workers on the front lines who are exhausted and don't have PPE. That brings me to our PPE drive. Mrs. Nacho's watching. She can put this in. You can tag her, Angel. We are trying to organize dental Nacho-focused PPE drives. Baljeet, my awesome resident, Todd Fleischman. Our team went today, had to run the lines at the office, so they went to our local hospital and dropped off PPE. Anything you can do to get PPE to the front lines. If you think of this as a battle against this virus and you're sitting at home helping, I'm sitting at home in my sweatpants helping. One day we're gonna have to go back to work. Probably need to get a bigger pair of sweatpants. But if we're sitting at home and we can help by sitting at home, what can we help the people on the front lines? Send them extra PPE. They need it at this time. The N95 masks are not practical for dentistry. Whether our oral surgeons or endodontists, people need to use them for true emergencies is something we have to keep an eye on. I'm here telling you, I don't know that answer. If someone has to go in for a true emergency and drill on a tooth, and a patient could be infected with COVID, we're not sure. We are in a very difficult situation with PPE, and I just want you to protect yourself. Also protect your team and protect yourself as an employer, because we're obligated to give the proper PPE to our team members for their work. And I think more information is going to come out soon. All right, guys. Well, that brings us to the end of our COVID update. If anyone has any questions for me, feel free to ask them. And in the Zoom chat, our CE challenge, that's what I say at the end. So we have a CE challenge. So some of you guys want to take advantage of complimentary CE. We're going to broadcast that each day. Self-study CE, watch in, we'll send you a link. But maybe some of you are real go-getters and you like to compete with yourself. So if you want to compete with yourself, we have come up with something just for you. It's very dentist. I know you like competing, right? Dental Student Hunger Games. But this is just a competition with yourself. So it's like Fight Club, Tyler Durden, Primal Fear, same guy in the same both movies. Pretty amazing. So this is what you could do. For $10, you can rent 14 courses. I've picked 16.5 hours of CE, 14 courses, some are over an hour, 16.5 hours of CE. You rent these courses, $10 for 14 days. If you do all the courses, and take the quizzes, we will give you $100 to buy more CE. You can buy souvenir CE, the one you watched that you can keep forever. You can buy other CE. You can take that $100 card, challenge yourself, $10 to get $100 to buy other CE. I feel like dentists like a challenge. This will give you some focus. Maybe do 1 a day, 2 a day. So that's the CE challenge. To redeem that, you just email amanda@dentalnachos.com with the title of this email. I did the CE challenge. Here's all my quizzes, and it must be awesome to work for Paul. Pretty long title. Here, I did the CE challenge. It must be awesome to work for Paul. So I just want to tell you guys, I'm thinking of you as we wrap up. Let me just go through my board one more time. Wait, we are all in this together. Safety, sanity, and stress is important in bonding and in life. You cannot do the first step wrong and expect to get the next step right. The first step right is social distancing. The first step right is taking care of ourselves by staying home, staying safe, stopping the spread, and also getting as much support as possible to our frontline workers. Go and donate those PPE, the extra PPE that you have. They need it. They're running out. They're on the front lines of this. 2 things we cannot buy back: health and time. I know this stinks. I know we're concerned about our P&Ls. I know that it's challenging on all of us emotionally, physically, spiritually. For the first time, our backs get a break, but it doesn't seem like that's so exciting at this time. But just remember, you cannot buy back time and your health. Money we can make back. Life is a long and annoying game. We have to have patience. Let's see what the CDC says. Let's see how they tell us how we can get our offices open safely again, and ask each other those 2 hows. How are you doing? How can I help? If we can help you, salsa@dentalnachos.com is the best email. I'm trying my best at night to take some breaks from this. So we have post approval on at Dental Nachos. So you're not in trouble. We're just getting so many posts that we're just letting them come out a little bit more slowly than normal. And if I'm not able to respond to everything quickly like I used to, sometimes I just take a break. This is my best friend, my phone, Mrs. Nacho and the family, also my best friend. So I have to split time between them. So thanks for being on with me. We're all in this together. I'm thinking about you guys. I'll see you guys tomorrow with a different Dental Nachos t-shirt on.